My daughter Martha was born 5 years ago in a small community hospital. She's my third child. I have an older daughter, a son, and then Martha. We did not know that she had Down syndrome before she was born. I had an uncomplicated pregnancy and a normal level 2 ultrasound. And so her diagnosis was a surprise to us, both me and my husband. She was born on a Friday, and normal delivery, very fast delivery. And it was during the first 30 minutes after she was born that we knew something was wrong. The OB nurse told me that the neonatologist was coming in to check the baby, and so the delivery and all occurs in the same room and then I'm with the baby in the same room. So within 30 minutes, the neonatologist comes in, and being a pediatrician myself, I realized that having a neonatologist come into the room to see the baby was not normal. So the neonatologist comes into the room, I think briefly introduced herself as the doctor to check the baby, checks Martha, which is away from me. I mean, she's a little bit away on a baby warmer, 10 feet away. Checks her, doesn't say anything while she's kind of examining her. Meanwhile, my husband and I are having fast heartbeats, knowing that something is wrong, and we're whispering to each other, you know, what is going on? This doesn't make sense. And I'm trying to examine my own baby from afar, 10 feet away, trying to figure out what in the world is going on. The neonatologist brings Martha over. I do, one good thing is I am holding Martha when she's talking to us about the diagnosis. But her first words were, does your baby look like your other children? Which probably wasn't the right thing to say, because in fact she does look very much like my other daughter. They both have the same dark hair, very similar facial features. I mean, she just same skin color. And if you look at pictures of my older daughter and Martha as newborns, as they grow up, they look very similar. So probably not the best thing to say. And she pointed out features of Martha to my husband and me about Martha has stubby fingers, she has a thick neck, she has facial features of Downs. So these are the words that she used, which made our experience not the best. That neonatologist, after giving the diagnosis to us that she thought our baby had Down syndrome, was going to do a blood test, she left the room, and I did not see her again. There was no kind of follow-up visit with me. There was no talking to us about resources. In fact, it was later that day or the next day that I actually had to talk to the OB nurse to say, may I please speak with a social worker, because I want to get more information about families in the community who have other children with Down syndrome. What are my resources? What do I do next? That was a big question that was not answered, is what do I do next? With that same day, my OB was also not very involved with giving the diagnosis or with follow-up. He was there when Martha was born, and granted it was lunchtime, and I know he had to go back to a busy practice, but he never even acknowledged that our baby had Down syndrome. And in fact, in subsequent follow-up visits, never acknowledged or brought up the fact that she had Down syndrome. And he was the one that I had a relationship with for the past several months with my OB visits, and I knew him well, and it would have been nice to talk to him about the fact that my baby had Down syndrome. Day number 2 of Martha's life, the pediatrician came in to talk to us. Some of the positive things that he did was sit with us quietly, calmly, ready to answer all our questions. However, from a medical standpoint, I think there were gaps. And I say this as a pediatrician because within that first 24 hours, Martha was becoming very jaundiced. She was already developing some feeding problems. And when I asked the pediatrician, what do we do about her heart in terms of evaluation of her heart, he said, we will just follow it clinically. There was no plan to get an echocardiogram within the next day, within the next month. And there was no, plan of what to do about her feeding. So a lot of missing elements within her health care early on in those first couple of days. Also, during that 48 hours we were in the hospital after she was born, another part of our experience was our copay with our insurance. And within the afternoon that Martha was born, a woman from financial came into my room to ask for my copay, which was well over $1,000, much to my surprise and my husband's surprise, and was wanting. She actually asked, "Are you going to pay with a check or credit card?" This is shortly after I got the diagnosis that Martha had Down syndrome. So all those pieces putting together did not make for a good experience for us. One shining light of the experience was when my oldest daughter, who was 4 at the time, and my son came into the room. My son was 3. So the afternoon after Martha was born, my other 2 children get to come in to see the baby, and they had been very excited during my pregnancy that they were going to have a new sister. And the previous few hours we were learning that Martha had an extra chromosome, that she was not the baby we had expected, that from a medical standpoint she was probably less than perfect, so to speak. However, when Abby comes into the room at age 4, she runs over to Martha and exclaims, "Mommy, she's just perfect." And so that was the one shining light in our experience, where the youngest 2, Abby and Will, really doted on Martha, adored her, thought she was absolutely fantastic. And since then, Martha's been a complete blessing in our lives, and I don't know. I can't imagine life without her. We've been extremely lucky to have her as part of our family. And for doctors, for nurses who have to give the diagnosis, I realize it's a very tricky place to be, where you have to give the news to a family of a diagnosis of Down syndrome. I think if you approach that family with the knowledge that for this family, this is a baby first, this is their new baby first, and this is a new mom with a new baby first, you'll be more likely to choose words that are not cold, that are not hurtful, and choose words like congratulations on your new baby, and point out features of that baby that are beautiful, because that baby is beautiful. It's important to deliver the diagnosis, give the facts, but give lots of resources, and most importantly, follow up with that family. Don't leave them hanging like we were. The OB needs to be involved, because that's the one who's had a relationship with the mother. The pediatrician needs to be involved. The pediatrician needs to be very knowledgeable about medical problems that this baby could experience. The nurses, the OB nurses, need to be very involved with this family to give them support, to give them a positive experience of welcoming this baby into their family.